in July last year. And therefore, that those who then finalized, who graduated, and those who were not posted that particular last year, who then ought to be posted. As per our collective bargaining agreement that was signed between the Ministry of Health and KMPDU, it is in Article 4 that after 30 days, once a doctor has done oathing at the Kenya Medical Practitioners and Dentists Council or at Pharmacy and Poisons Board, then they need to be posted to their respective internship centers. But in this case, interns were not posted. So we continue following up with the ministry by writing different letters until in March they promised that they'll post them in April. That was after we had issued a strike notice to that effect. But then later we learned, because in our demand of strike notice was that interns be posted as per the collective bargaining agreement. We did not know that there was any nefarious plan to actually reduce the wages as agreed in the CBA. But we came to learn that there was a SRC circular which was reducing the wages of these particular interns, not really as per the basic salary, but the allowances. Because you know that as per this, the collective bargaining agreement, when an intern is posted from 2017, they get paid a basic salary of 42,970. They're then also being paid allowance, that non-purpose allowance. They get paid call allowance because they're on call. They get paid risk allowance. They get paid house allowance because they stay in those particular. They have to they have to get house where they stay. Also, they paid commuter allowance. But these allowances that were agreed upon, that SRC gave letters of no objections, were then scrapped without any consultation. So there was a clear violation of the CBA of the union. That's what has brought the contestation that we have between us and the Ministry of Health, where yes, they now want to post them because that's what we're demanding, but they're violating the CBA, meaning that no doctor in the country will be safe because the same way they will violate this for the intern doctors, they can violate for any other doctors. I want to bring into context that before this CBA was signed, in 2011, doctor interns were earning 160,000 as job group L entry with allowances. We were then demanding for them to earn 357,000, which was signed in a CBA in 2013. Government disowned this particular CBA, which resulted into 100 days strike. The offer that they've now been earning for the last 7 years was actually offered by government, which was then signed. And SRC gave letters of no objection in 2017. Therefore, reducing this to a consolidated value of 70,000 is taking back the aspect of work by entry level of doctors to 25 years back. And that has been the bone of contention in this particular strike, and something that has not made any progress. The other issue that was also very critical, the two things, was the issue of Kenyatta National Hospital, where we have doctors employed on different rates. We have doctors who are earning a third of their fellow colleagues, and they're working in the same environment, doing the same job. In all aspects. So these ones also were demanding they be harmonized so they can earn equal, because it's always a matter of equal work for equal pay. And this relates also to what happens in Kenyatta University Teaching and Referral Hospital, where doctors are being employed on on a daily basis, or on a 1 month, or at most 3 months, to the point that even if you have a patient, by the time you finish the process of managing start managing this particular patient, your contract is already ended. So it's always at the detriment of the patient in this particular QTRH. Those are the concerns that you had that are pending in the national.
Thank you very much, Dr. I think I will allow the Cabinet Secretary for Health to give us a status on that. And
just one more thing. There's also what I raised earlier, which also pens in national, because it goes with the registrars, where we have Kenyatta National Hospital, Kenyatta University Teaching and Referral Hospitals, Moi Teaching and Referral Hospitals, where we have registrars. We have doctors who, in this case, are not from counties. In this case, are doctors that are self-sponsored and are working in these particular hospitals. They are on rota doing their masters. They generate revenue for these particular facilities. They don't get any pay. They are actually during the day they're working in these hospitals. At night they have to moonlight to actually survive. Yet because of their existence, these hospitals are not employing. So ideally, it is only in Kenya, it's only in these referral hospitals where these doctors are being exploited. We call actually slavery. If you go to where Dr. Nyikalo studied in Australia, every services that you offer, as long as you're in the rota, that you're offering services that are being paid for by these particular patients, you ought to be remunerated. Thank you.
And maybe as I allow the